have Kathleen Sharp, who is leading this cloth mask project and trying to get all the seamstresses in different areas. So she has developed a prototype to and guidelines on the measurements and what sort of cloth would be needed.
I was able to approach these treetop quilters and sewers, and they began, and within 2 days they had 800 masks cut out. And this is a fairly small group of ladies, but very committed, and they've begun sewing that. We are now, as of right now, we have 700 volunteer seamstresses across 3 states.
Cloth masks are usually they're not fluid resistant. It does help to act like a protective barrier covering your mouth, and so any aerosols or droplets which come out of your mouth, it definitely helps prevent spread of that.
We had to keep in mind social distancing, which added a special challenge. So in our neighborhood, we have a cabin, a sewing cabin that has wonderful tables for setting out patterns and sewing machines. But of course, with the coronavirus, we couldn't have them gathering together. So we had to figure out a supply chain. And so they move the materials and are doing those individually in their homes and texting each other and calling each other to make sure that the construction and the materials are done, are moving to whoever needs them. They are then dropped off on a porch, and I do the pickup.
For healthcare workers, it should be used as a last resort. And since we currently have PPE available, our regular surgical masks and N95s, we don't plan to use it on healthcare workers right now who are directly in contact with patients. However, in future, if we do not have any PPE, then there is a possibility that we will use this even for healthcare workers.
If other people want to get involved, all they need to do is email communitybenefit@atriumhealth.org.